All right, good morning, everybody. It is 9:31 in the morning. Appreciate folks joining us, all of our personnel that are in stations or calling from home. Appreciate everybody on the call today. This has been something that's been long in coming for us, and we want to make sure that we can get this to the membership with all the findings that we have in our 2019 standard of cover. Just so everybody knows, we have a moderator. Both Corey and Maria are on this presentation, similar to council meetings, and we're recording the event so we could share it with everybody. We will be able to mute or unmute your mics if you have any issue with that. We, of course, encourage questions, which we'll hold to the end of the presentation and make sure we get those answered for you. I want to walk through a couple of things before I turn it over to Chief Walker. The fire department has a history of reviewing our deployment. In 2008 with our staffing and capabilities study, 2013 with the deployment committee, 2014 with GIS analytics used for deployment, and 2018 we issued an RFP for a formal standard of cover of emergency response, looking at our deployment from a very analytical perspective, historic call volume, response times, turnout times, dispatch call processing times, etc. Our goal has been to assume that we're and assure that we're utilizing public dollars wisely in the department in the deployment of our resources for the guests and residents of Santa Monica. And I think this report clearly articulates some areas where we can have some organizational focus over the next few years to try to meet the growing demand of our services. Some of you are very familiar with the findings. There's not any real shockers that came out of this particular document, but I will tell you that it's already resulted in some positive changes, specifically in dispatch and the way that we do call processing time for homeless man down. And that attention to the issues are critically important to reducing our response times. So we'd like you to hold your questions until after the PowerPoint. I'd like to go ahead and turn it over to Chief Walker for a couple of comments, and then Stu, you'll take the floor. So Chief.
Chief, we're not hearing you. I see that you're unmuted, but no, there's no audio coming from you. It might be that the wrong audio device is set up. And if you can find your settings button on your phone, you'll click on that. You'll be able to see your default headset and microphone. Yeah, I hear you now. You're pretty low, so just speak up. Now I'm not hearing you.
Corey, why don't we go ahead and move on, and if we can get it fixed, we can close with some comments from him. I know his comments are very brief today, so why don't we go ahead and turn it over to the Citygate folks who will introduce themselves and get started with the presentation. Morning, Stu and Sam.
Good morning, Team Santa Monica. My name is Stuart Gary. I'm the Public Safety Principal for Citygate Associates. And what the heck is that? Citygate Associates LLC is a small firm. We only work for state, local, special district government. Sam Mazza is with me today, who also helped do the risk assessment. In brief summary, we are both retired chiefs of department. We've spent our entire working lives since late teens and early 20s in the fire service. I helped invent the standards of cover process for the Commission on Accreditation back in the late 90s. And I've been, thank you, California pension system and entering at a young age. I've been full-time consulting 15 years since I retired as a chief of department. Sam and I are both north of well over 300 to 400 studies at SOCs. We've done everything from the tiniest departments, mostly in the Western United States, and also all of the largest departments. We just completed OCFA's SOC last year, and LA City is a current client, among others, in the Southland. With that, I'm going to share my screen and start a PowerPoint. Chief, is the PowerPoint up full screen?
We've got it. Can see it.
Okay, thank you. So let me start before we go into Santa Monica. For those of you that may be new to the standards of cover process, and what is the term standards of cover? When accreditation was founded in the mid-90s, to become an accredited department, they asked a series of questions. Well, how do we measure a department? And when they got to customer service at the field level, they looked around the world. And literally, the United States is one of the few first world countries that leaves the level of fire and EMS deployment to local government as a local issue. And in Europe, the first world European countries, down under Australia and New Zealand, the term standards of response cover or standards of cover is used. You go visit a fire department in Western Northern Europe, down under, and ask the chief of department, can I see your standards of cover? You'll be provided a study, a booklet of analysis that drives their deployment thinking. So that's where the term comes from, and it's part of being accredited for those departments that pursue accreditation from the Commission in the United States. We start all of our briefings, both for elected officials and department members, with that reminder that I mentioned a moment ago, that there are no mandatory federal or state regulations warm up my mouth this morning, directing the level of staffing, response times, or outcomes. In the United States, land of the free, home of the brave, don't tread on me. Government has left the provision of fire services to be a local issue. If you're a general law city in the state of California, there's literally about one sentence in the government code that says provide for the protection from fire. No other details, just provide for fire protection. We remind all of our clients, however, increasingly in the last 20, 25 years, that the safety regulations on equipment, personnel, and practices have gotten severe, and best summarized this way, that if fire services are provided by a local entity at all in California, it must be with the safety of the firefighters and the residents, citizens they serve in mind. We then, at this first level, before we get deep in the maps and stats, remind especially civilian leadership that deployment is about two basic theories lifted from the British and military thinking. Oh, by the way, these are not a Citygate invention. And speed is that single neighborhood-based unit designed to be located out in the neighborhoods, crewed, staffed, equipped, trained to minimize and terminate small, modest emergencies, things that stay at a single responder level and need fairly quick speed to keep them from becoming a first or greater alarm. The weight of attack is amassing multiple units quickly enough to stop serious fires. So especially in fire departments doing EMS first response, whether it's BLS or ALS, there's a constructive tension. If I spread the stations too far apart on the geography, then I can't weight of attack multiple units back together quickly enough to have an effective first alarm in a timely manner to a serious emerging fire. So you'll see us talk about speed and weight, or the GIS term for speed is the distribution of stations, and accreditation, the SOC calls the weight of attack, the concentration of force, or your ability to concentrate. Sam's going to discuss risk assessment now.
Thank you, Stu. So in setting service level goals, we look at several factors, including the time temperature curve in building fires, EMS survivability in various types of EMS emergencies, the ability to suppress outdoor fires before they spread to other buildings or outdoor areas. In essence, keeping small fires small and saving those with potentially fatal medical emergencies. So again, we deal with response time goals for fire and technical rescue with the policy goal of providing adequate response times to all similar risk and population density neighborhoods. Next slide. So as a summary to our community risk assessment process, which is included in detail as an appendix in the final report, we start by quantifying the values to be protected in Santa Monica, including those unique to the city, including the pier, the beaches, freeway, the metro rail, short-term rentals, and your daily business and tourism-based populations. Next slide. We then identify hazards likely to impact the city, specific to services provided by the department, followed by identifying the probability of a hazard occurrence based on historical hazard occurrence for each of those hazard types, and then evaluate the probable impact severity of a hazard occurrence considering the factors you see here to arrive at an overall risk rating for each hazard by station response area. And those overall risk ratings for the city of Santa Monica range from low to high, each of 6 hazards that were identified in the overall risk assessment.
And when you read the full written report, if you haven't received it yet, you'll see a scoring table that summarizes low to high risk by station first due area. And one of the reasons, among several, we use risk assessment is back to the concentration of force. In a hypothetical department, if I had a cluster of higher risk properties that did not receive the concentration or an effective first alarm force, that would pop up as a gap, an issue to be fixed in a deployment study. If on the other hand, I have my higher risk areas effectively covered by a first alarm, AKA effective response force, but my suburban edge, lower density, lower call volumes aren't quite reached by the last due unit, I might not choose economically to fix that as quickly as my urban core issues. Jumping to statistics summary, and there's 40 pages of statistics done in a study like this, but in summary, over 4 years, looked at incidents by year by type. EMS was slowly growing up through obviously the beginning of COVID-19. Fires were relatively flat, and your other types of events were somewhat volatile up and down over the year. Pretty typical suburban California fire department with slow, not necessarily explosive incident growth. Calls by station by year portrayed here, and as you know, where your busiest stations are and where some bid want to work more so than other stations perhaps. This also, though, comes into focus with elected officials because they'll look at a very low call volume station and in recession, COVID-driven recession, say, well, let's turn off services to save money and let's turn off the slowest station. Well, that's a natural response. You have to also circle back to, but why should that district receive double the response times as somebody else? Shouldn't coverage be equitable across the geography? Or stated this way, shouldn't every tax-paying location receive an equitable level of customer service and response minutes for their type of risk? We'll talk about that more maybe as we discuss the maps. If we look at your incidents by hour of the day, you're like just about every fire department, but one exception, literally in the United States, where low tide for incident volume is after midnight, dark early. And then with morning rush hour, you start to climb. It's interesting, your climb to max workload volume is relatively slow, 3+ hours there. You don't really hit a peak until after 10 a.m. And then we call that the shoulder, pre-COVID. Other people use the term shoulder to a graph curve. And you drive across the top with pretty constant incident volume demands year over year. And then you taper off with the evening rush hour. We can show you graphs from other clients where incident growth is explosive by 6, 7, 8 a.m. And the shoulder, the high workload pattern in the day, becomes very flat from 8 or 9 a.m. through 7 or 8 p.m. So you do come up with morning rush hour. You stay fairly busy. You taper much more slowly starting at dinner time back to midnight. We then look at simultaneous incidents, and in the 4 years, you have 2 incidents open 57% of the time. So lightning strikes at high workload hours. Everyone in the department knows that. You have 3 or more incidents open 22% of the time. So that's actually good news. In a multi-unit, multi-station department, your simultaneous incident volume drops off fairly quickly, and having 4 or more units working drops statistically off the cliff to 6%. And so if you were an island with no auto or mutual aid, and I know you're up against the coastline and only get aid from mainly 2 directions given the mountains to the north, we wouldn't be as concerned with these statistics because you've got enough first responders to provide 2 or 3 EMS incidents at once and still provide an effective first alarm if something serious happens before you're forced to reach into automatic aid. Now, what is problematic, and we'll get to unit hour utilization in a moment on crew busyness, your number of simultaneous occurrences by station area vary demonstrably, and no surprise to the members of the department, station areas 1 and 3 have the greatest propensity for simultaneous incidents. So when they run out of resources, they obviously have to draw units from the adjoining station areas, which can create large deployment gaps in the city at peak hours of the day because everyone's clustered into districts 1 and 3 running calls. So now let's look at unit hour utilization. We started using unit hour utilization, almost a decade ago now. It's common in the private ambulance sector from about 30 years ago. And the way to read this table is, here's your engines across the top, 24 hours a day in one 12-month period, 2019. What is the percent of time engine 3 is on an open incident clock, hour by hour? So this is the percent of time you're logged into an active incident. This doesn't account for travel back to station, fueling, food, anything else that you might be cleaning up, deconning once you're clear to respond again. And as you can see, Excel heat maps with a darker red color, that busy factor, and engine 1 mathematically peaks out on an annualized basis at 3 in the afternoon with 23% of that hour they're on an active incident. And that's a pretty demonstrable increase. They hit 21% at 11, kind of quiet, not relatively quiet midday. And then there's another burst of activity, and then they kind of go back down to the mid-teens. So you could almost say the mid to high teens is more the norm for 3s. 1s stays in the mid-teens. 2s, I believe, due to move and cover events, stays in the low teens and then spikes late afternoon as it's assisting others. And there's other data in the report that talks about that. The department's question, every department's question should be, well, when is my percent of workload per hour too much? And when should an area deserve a second or third responder? In other words, when do we double or triple up a house in the American Fire Service? And Citygate's published belief for years now has been when a crew is hitting 30% hours on end in a normal fire service workday, they've ceased doing almost everything but essential safety checks and refueling and deconning. You're going metaphorically call to call to call, and at some point crew exhaustion should become a factor. So we do have metropolitan clients with engines and transport ambulances that are in the 25th to 35th percent workload. A couple of units once in East San Diego hit 40% engines. We're hitting 40% UHUs hour after hour. So if you occasionally touch 30 in 1 hour and slide back down 10, 15% less, that's not as much of a cause for concern. But if you're going call to call and not getting the second most important thing, in our opinion, training done every day, where you're trying to just do computer-based training late in the evening while you're tired trying to catch up, that's not necessarily effective. Your unit hour utilizations are not yet to the point by crew that demand an immediate fix. Let's look at response time performance. The department has the following current goals. Dispatch call processing of 1:30, 90% of the time. That's also a best practice, both for Citygate, the NFPA, and other dispatch processing best practices publications. Crew turnout, your goal was 1 minute or to 1:30, 90% of the time. Published best practices from accreditation and the NFPA range anywhere now from 60 to 80 seconds, depending on the type of PPE being put on. And we have found historically, doing this for over a decade now, it is an extremely rare fire department that can hit 1:30 turnout time 90% of the time, whether they're waking or asleep. It's worse during sleeping hours, and your data is in the study. But by the time you hear what is going on, put on the right PPE, are seat belted and moving in the rig, tough to hit 1:30. You can do it with focus, especially daylight hours. Evening times, you're much slower sleeping times. Citygate's recommendation for years on a 24-hour basis is to hit 2 minutes 90% of the time. Now, if because of station design, that's literally impossible during sleeping hours, we've encouraged our departments for 5 or 7 years now, as Santa Monica did with the 1 and 1:30, establish a split measure, have a waking hours crew turnout goal and a sleeping hours crew turnout goal, and then give that data back to the company officers and the BCs for oversight and discussion if someone isn't coming close to hitting the goal. Your first due travel goal, it was 4 minutes, 90% of the time, completely consistent with urban fire protection recommendations, but not only from us, but from NFPA 1710 and others. So that's the best practice column. And then multiple units, concentration response time to a single incident should be no more than 8 minutes travel. That was your goal. It's also the goal out of NFPA 1710 at 90%. So let's see how you're actually doing. Well, somewhat disturbingly, especially in dispatch during the years of the study, not that well. 90% of your NFIRS coded fire and EMS calls. I want to stress this. This data slide is for fire and EMS incidents, not including any of the others. So these should be, for the most part, your code 3 responses. Dispatch processing at 90th percent was 2 minutes and 36 seconds, a whole minute or more longer than desirable. Crew turnout is 250. You're 50 seconds past our Citygate measure. That's driven more, slightly more by nighttime than daytime. Your first due travel is 5 minutes and 19 seconds versus a 4-minute city and NFPA Citygate goal. Your effective response force, first alarm concentrated travel, is 8:10. So here's an interesting dynamic. As you have simultaneous calls and traffic congestion and due to station location, your first due travel times are longer than 4 minutes. But Santa Monica is compact enough, and I'll show you the maps in a few minutes, that you can get multiple units in 8 minutes driving time everywhere in the city, almost everywhere in the city. So while the mapping and our analysis will recommend you have a distribution of stations problem, you don't have a concentration of force problem just given to the street design and the compact nature of the city. Therefore, for fire and EMS incidents, your call to first unit arrival, 90th percentile, is 9 minutes and 10 seconds, almost 2 minutes past the Citygate recommendation of 7:30. and your effective response force call to arrival is 1116, and that actually is better than our and NFPA's summary recommendation of 1130 from time of dispatch saying hello. So your ERF numbers are good because your ERF travel is pretty good, and you're making up for losses in turnout time and dispatch time. If you want to look at call to first arrival times, and many times our elected official clients say, well, how many calls did I get to in the early minutes? Well, you do accumulate in a histogram distribution view of the data. Prior to 4 minutes, you are getting to a lot of the calls, and you're getting, depending on the station area, 70 to 80% of the calls. The reason why you're not hitting 90% at 4 minutes is because when you're chasing calls across the city, or you're trying to get to the upper city where you don't have fire stations, you have mathematically too many calls with travel time significantly longer than 4 minutes. So that drags the 90th percentile out. So it's a question of how do we want to perform, and what would it take to bring 90th percent closer to 4 minutes, given the high number of calls that stretch way out for travel time, and in some cases 6, 7, 8, 9 minutes. So we started to drill into, well, what's going on, and especially with dispatch. So we heat mapped and pulled separately dispatch data for fire and EMS events with dispatch 90th percentile processing times of greater than 3 minutes. I want to stress, this is not up to 3 minutes. This is the location of calls that spent longer than 3 minutes in dispatch queue. And it's no surprise to anybody in the department where most of your outdoor environmental socioeconomic emergencies occur. We then looked deeper and said, of those lengthy calls in dispatch, what types and where were the medical emergencies? And they were clearly downtown, the pier, the waterfront, as the mapping indicated. We then, because fortunately, instead of looking at just downtown, Santa Monica is conveniently divided into zip code slices. It was easy to capture the data by zip code. So we looked just in 90401, and we found 1,580 outdoor EMS incidents. But of those 1,500 calls, just 15 chief complaint types accounted for 1,312 incidents, or 83%. Viewed at citywide, those top 15 chief complaints only amounted to 43% citywide outdoor EMS events. Again, outdoor to outdoor, citywide, much more diversity of outdoor EMS dispatch complaints. Down in 90401, just 15 complaint types dominated. So given that cluster of outdoor EMS events, we compared those top 15 complaint types, to dispatch and travel. So this table in the report drills into, there's your top 15 dispatch types in the left column. Now we know those are not necessarily outcomes, but in deployment, we have to acknowledge that what dispatch hears and tells you to go on is what we have to measure dispatch turnout and travel time by, because you don't know what's different until you get there. So this is not retrospective. This was as the event went down live. And you can see there that on some of these, injuries from assault, behavioral patient, trauma 2, unknown medical problems, dispatch was spending 5 minutes discussing with one or more parties what was going on, what to send, or perhaps what the law enforcement send should be. And then, because most of these, not all, but a lot of them were peak daylight hours or peak human activity hours, like sunny days on a weekend or a holiday, your travel time was also fairly long to these locations. And when you stop to think about that, it actually makes a little bit of sense because they're outdoors. and maybe you're slow the last 50 yards to go on scene and stop the clock because you're still looking for exactly where on the sidewalk where the parking structure the patient is. So the total response time to those top outdoor medical types was 9 minutes and 28 seconds. Now, how many of those are life and death emergencies versus reoccurring modest to minor medical emergencies is a different issue. But you've got stations in the core, companies in the core where these existed, yet it was still taking just under 10 minutes to get to the patient. Not the patient, to the incident location. So let's look at GIS deployment coverage. We use a computer-generated GIS tool that creates a virtual fire truck drive the street model. So we start with posted speed limits. We take all of your travel time stamps by type of street over a year's period, and we slow speed limits down to what fire apparatus are actually doing on streets and boulevards, the freeway in Santa Monica. And then we build a second model with traffic congestion data. So we can get exquisite high quantity traffic congestion movement data, not social media, not Waze, not self-reported, but different data sources. The kind of data that paints a Google or Apple map, green, yellow, or red for congestion. And we build two travel time models. And this is the 4-minute travel, and in green is what you're covering at 4 minutes non-congested. Depending on your computer monitor, the reddish color is what you're covered during congestion. So you can see how congestion, depending on different pockets of the road network, shrinks coverage. But even with traffic congestion, even severe traffic congestion in the core back of the waterfront, because of the station locations and the multiple units, you're getting travel coverage in theory at 4 minutes. Now this is where the model, this static model, can't take into account, but what's travel time like at peak rush hour, and station one is out of units, and cover units have to fight their way down to either downtown or the foot of the pier. If you look at a similar study of traffic congested or not for the first alarm, the effective response force, in your case, the clock stops with 4 engines, a truck, a BC, and a hazmat unit out from the airport. And you can see now your station locations are not universally distributed across the city. Over the years, various decisions were made for, we're sure then valid, or what was thought to be valid reasons, to have the multiple company sites and not have stations in that upper almost third of the city. So your first alarm coverage for traffic congestion is pretty good downtown and in the lower 2/3 of the city. Uncongested, you get further into that upper city, but you don't get all the way to the city limits. And that makes common sense because obviously stations 1 and 3's units can get up there, but they're waiting on units from station 2 and station 5 to arrive, and those later arriving units are what drags down the coverage in this view. If you look at just the travel time of 1 unit in 8 minutes, we always look at the ladder truck. So we take the multiple unit map apart and say, well, gee, is there a single responder holding up the coverage last due? And in this case, from your truck location, the truck can get, in theory, uncongested anywhere in 8 minutes. This is back to that concentration time finding that when you do have to send multiple units to a call, you can get most everywhere in 8 minutes. Now let's look at workload distribution. Here's a common scatter plot of every type of EMS event in the 4 years. And you can see almost, not every, but almost every 100 block in a road network is an EMS demand consumer over a four-year period. And you start to see, obviously, more dots on the major roadways with commercial and apartment buildings fronting the street or where your outdoor medical emergencies are. If you look at 4 years of structure fire data, somewhat randomly scattered, but in a way, not so much. And when you look at a Google Earth photograph, as we did, and drive the city as we did, you all know it. In that upper section of the city, once your zoning converts from multifamily residential to larger parcel single-family residential, it was interesting even to us and our work with other agencies that in a 4-year run, there were no reported structure fires up there. Kind of failed common sense. That's what the incident record says. And remember, in NFIRS, when you code a structure fire, anything it can be almost a structure fire, including electrical arcing, out on arrival. NFIRS is pretty liberal with what they ultimately call a structure fire. And there were just not those events up there socioeconomically. But the rest of the city, they're somewhat scattered. There's not a demonstrable pattern there to say, wow, I really need to change my first alarm concentration of force location. If you now turn to hotspotting maps and you look at EMS hotspots, again, a 4-year period. Now, demonstrably, if the yardstick of locating stations is to put them where call hotspots occur, then 7, 1, 3, to a slightly lesser extent 2, you've triangulated the highest workload EMS areas of the city. Now let's talk about traffic congestion loss. The computer measures how many public, so these are not shopping center apartment complex roads, how many public street miles are reached in the 4-minute drive time model. And uncongested, 73%, you don't hit even 90%. That's again due to the stations being closer together. But then in congested, it falls to 55%. So you lose, rounded up, 18% of your reach during traffic congestion. The first alarm loses about 22% of its reach. And if you looked at engines only, we took the hazmat and BC out in the truck and just looked at 4 engines in 8 minutes, which given 4.0 staffing, still 16 firefighters, and hits the NFPA initial effective response force target of 16. The engines are only losing 3% reach at traffic congestion at 8 minutes, because again, 8 minutes is a pretty large, almost liberal measure. So what are our deployment findings? That fire travel times are longer than desired due to the combination of station locations, the road network, and traffic congestion. Call processing and crew turnout times are too long. Call to arrival at 9:10 is significantly past what we would suggest as an adopted department goal of 7:30. The first due unit travel distance time is problematic in the north sections of the city. No single unit or station is approaching single unit workload saturation. Outdoor EMS in Santa Monica is a significant problem. The fire stations, again, are not spread out enough, in our opinion, in the north section of the city. We also find, given to the high volume and unique nature of the outdoor medical emergencies, you could consider an adaptive response unit to those outdoor medical emergencies where they're most prevalent. So what do the recommendations look like? Improve incident data capture. The chiefs can brief and discuss with you offline. We had tremendous difficulty initially getting clean incident data out of your legacy dispatch and NFIRS systems. And that was not the result of the data not being in the system, but the database architecture and what the technical ability of the city employees were to export and make the data what is otherwise commonly available for modeling. We solved that, but it was much harder than it needed to be. And you all need to manage with data and let data point you in some decision-making directions. And recommendation number 1 is you need to improve the ability for the management team and the leadership of the local to obtain incident data and understand it and discuss it. We want to see 911 call processing and dispatch performance demonstrably improved. and to improve a little bit the crew turnout performance, whether it's an AM and sleeping time measure, or just 24 hours a day, hit 2 minutes 90% of the time to fire and EMS events. Then in North City coverage, now understand this is written pre-COVID-19 economic train derailment. A permanent 25 to 50 year fix would be to deploy another 4-person engine to the northern 25% of the city. Or initially, if finances would constrain that, consider a 2-person paramedic fast response unit from a smaller commercial location to improve first responder times to the North City to just EMS events. And as all of you know, LA City and others, San Diego City, have or are pilot tested concepts like that. And we would see that as a stopgap measure because your effective response force reach and your multiple unit reach in that northern 30%, however you want to measure it, of the city is less than best practices. Recommendation number 3, the Pier Beach area, western downtown area, given the longer travel times, you should continue to provide at least a small fast response unit in the immediate area. Now, economics may dictate that that's day of the week and seasonally driven. Once C-19 gets you at all close back to crowds and human movement like you were before the pandemic. And then the recommendation for an adaptive outdoor EMS response is to consider developing a program to deploy a specialty team, most likely of a firefighter, paramedic, and an allied healthcare person to better meet the outdoor EMS needs. Other agencies are doing or prototyping that. There's high interest in other areas of the country to do that or pilot programs. Medicare has just announced the first round of grant funding for pilot projects to do this that would receive Medicare reimbursement. But the problem isn't just you all designing a system to perhaps get a paramedic and a mental health professional or a specialty nurse to some of those outdoor homeless and drug abuse problems. It's what do you do with the patient if they're really not needing of an ER? So the systems that are pilot testing adaptive outdoor response acknowledge and have developed pathways, whether it's detox centers, a city provided clinic, a hospital provided clinic. There has to be one or more locations other than an emergency room to deal with these people. One of the popular programs that gets a lot of the International City Manager Association is a program up in Oregon called Cahoots, largely a nonprofit under city fire and EMS leadership, and they deploy allied health and mental health professionals to streets and other environmental medical emergencies. But they have a pathway to take them to treatment and assistance locations other than an emergency room. So we're not, Citygate, Sam and I aren't being a Pollyanna that if you just put 2 different people on a fast response unit, it demonstrably changes your headache of when someone doesn't need an emergency room acutely, what else does public health do with that patient? Dispatch time, we recommended, and as Chief Klimo said at the beginning, conduct a detailed software and human ergonomics study of why is it taking longer than 3 minutes to at least get fire moving to an outdoor medical emergency. And if there were valid reasons unseen to Citygate that it really takes 3 to 5 minutes to pin down a location and who to send, then you shouldn't hamper your EMS 90 percentile measures with those incidents. You then ought to provide a split department response goal of in-building EMS events, and then separately measure your response time performance, quantities and types for outdoor, ocean, beachfront, pier, freeway events that just take significantly longer both to dispatch and physically get to. We, at the end of the report, also put in a more explicit recommendation for the council to adopt. Accreditation wants to, and we've stressed for 15, 20 years now, that public elected officials need to adopt formal response time goals by which to revolve the budget and staffing conversation year over year. And those goals need to be very prescriptive, because as people read them past the current leadership, they need to understand both the measurement of time and what the outcome. Well, why have response time if you haven't defined an outcome goal? So in this slide here, you'll see it's to handle pre-hospital medical emergencies and control small fires. The first due unit should arrive within 7:30, 90% of the receipt of the 911 call, and that breaks into a 90 seconds dispatch, 2-minute company turnout, and a 4-minute travel time. Next steps, as we concluded and published a report, obviously the department and city leadership have to consider the findings and recommendations, adopt revised performance goals so it's very clear what's being measured and what the outcome is from a council perspective. Work with a communication center to reduce call processing time. And then as economics and other strategies come into play, consider the issues with the North City and the distribution of access and response time. Longer term, fund the addition, once again, of a Northern City full-time response unit. Discuss partnering with other agencies on the outdoor medical emergencies, and continue to actively monitor response time performance. You shouldn't have to do a study every few years and then say, not that you did this time, but we've had other clients so infrequently study themselves that they don't see the erosion of response time or the erosion of crew capacity with unit hour utilization. And then they're surprised by, holy cow, where did this come from? Well, you dug the hole incrementally, client, over 3 to 5 years. And you need to be constantly monitoring performance. It's going to be volatile and be up and down a little bit, but you need to have multi-year trending and see trouble happening before it becomes a crisis. And with that, I'll conclude the PowerPoint, and feel free to, Sam and I can take any questions you might have.
Thank you, Stu. I appreciate it. Sam, thank you very much. Excellent presentations always. I'd like to go ahead and open the floor to questions. Make sure you unmute your mic to do so. There's also a chat feature if you want to put questions into the chat, and I can ask them of Sam or Stu. So let's go ahead and open the floor to any questions.
Can you put back up the recommendation slides, please?
Okay, let me go back to share. Which one?
Probably less the ones that relate to dispatch, but more kind of our response models.
So this was dispatch and turnout time. This was North City coverage, adaptive EMS. This one perhaps?
Sorry, we just went through them so fast. I just wanted to look at them again to see.
Oh, okay. I'm trying to get to exactly. I'm sorry. I thought you had a specific question on just one bullet. These are also summarized. They're more fully written out in the full report.
So Chief Como, as we transition to a new CAD system, do we think the data will get better just based on the archaic data system that we're using now? So that's somewhat a little bit trimming around the edges on some of like the call times and that type of stuff?
Well, there's really a few issues that we found, and they were not surprises. So in our old Embers database, it was incredibly difficult to parse out the data that we needed. And CityGate's team spent hours and hours doing just that. Since we've transferred to both digital EMS and our current RMS platform of emergency reporting, things became significantly easier to figure out. So it's the historical data prior to emergency reporting that was tough to deal with. So what we're getting now and what we'll get moving forward is a lot easier to parse out and figure out. And with emergency reporting, many of the reports that Stu is able to generate, we can generate automatically through ER. But what CAD or a new CAD will certainly provide us is the ability to be much more dynamic in how our resources are deployed. For example, peak periods during the day may change what occurs at Station 7. Peak periods during the time of year may change. So the zone for Engine 7, instead of being Ocean Avenue and the beach, may bump up further and include San Vicente, because we know that their availability is higher, their travel time is although longer, they're not fighting the traffic that we see in the summer. There's a lot of CAD systems, modern CAD systems, that will allow that exact thing to happen. The other piece is just automatic vehicle locate. We do spend a fair amount of time just punching out units based on station location when we should be punching them out based on proximity to the incident. And that is an automated feature in a new CAD system as well. So I think we will see a significant benefit to just that. And I know both Lindsay, I think Lindsay's on as well on this call, but just the ability to have a higher situational awareness of where our apparatus are that's automated through CAD is going to make it significant.
Hey, Tom, I'm back on too. I've been on for the whole time. Hopefully you guys can hear me now. I apologize for not.
We got you, Chief.
Not sure what happened earlier, but I'm here for any questions also.
Any other questions or comments, thoughts from the group that's on right now?
It looks like we have a couple of questions in the chat. So one of them is, without implementing a 2-person unit to cover the area in need, if we implemented recommendation number 4, how much do you think that would help our unit availability in other districts?
Without going back and looking at the detailed numbers in the report, it would obviously strip at peak hours all of those calls off the backs of the full crew. So let's just hypothetically say if a call an hour at peak hours of the day came off, you're certainly going to see some help on response times and crew availability. But the thing you can't really prospectively model is how many simultaneous events occur. So if you just have an afternoon of a lot of double and triple single response calls, certainly that unit's more of a help mathematically than it would be if you just hit a 2-hour period with nothing else much going on. And you've got plenty of units in quarters. So it's a little variable. We look at it also as not just cost of staffing and running a big rig down to a frequent flyer, but in fundamentally giving people with additional training and maybe someday certifications and qualifications to really handle the patient differently and to get them to a different location. So it's a different skill set of handling those patient cohorts versus just saying we're only going to do it to improve response times. Because if you look at your unit hour utilizations today, you're nowhere near 30%. So on paper, at least, you have plenty of even peak hour capacity to do 2, 3, 4 EMS events overlapping in the downtown area. Hope that answer helps. It's complicated depending on what measurement lens you want to view the issue through.
Another question we got is, did the consultants see a degradation of response in the Pico corridor? Are there any recommendations for that area?
Not specifically just in that corridor. We didn't go in on a boulevard by boulevard or cross street to cross street sense. We tend to look at the larger picture. Having driven, been in Santa Monica, even trying to transit Santa Monica sometimes, not even when we were working for you. Certainly the rush hour traffic congestion and the light-to-light gridlock can be severe. And many of our clients, the first responding company officers and drivers know those peak hours and are already driving workaround streets and avoiding some of the corridors they just can't get through at peak hours. So if you look at your travel time data overall, being north of 5 minutes, it's for all those reasons.
Another question may be geared towards the chiefs. Is there a plan to replace the CAD system in the future?
The answer to that is yes. The RFP is out and has come back. The next few months will be RFP review, award, and contract. My experience with CAD systems, I don't think we would be functional with a full switchover until about 2 years from right now. Any other questions? I don't see any other questions in the chat. Oh, wait, there's one here. Go ahead, Maria.
Let's see. With the increase of resources, does this report assist with supporting the addition of adding logistical staff, for example, a second fire mechanic to support the increase of our fleet?
Only indirectly. So this study was only about deployment. When we do master plans and strategic plans for departments, we do evaluate all of headquarters, bureaus, and logistics support capacity. So we don't know today, Samurai, your mechanic or logistics supply, fire prevention, office support, technology specialist workload ability. But departments need to measure and have workload measures for those people and their teams and know when saturation is creeping up and hurting internal customer service. So absolutely that work can be done, as well as shop procedures, software reporting, tracking downtime, how many units do or don't go out to outside vendors, and do they get lost for days or weeks with outside vendors, et cetera, et cetera. There's a whole lot that could be studied in that area, and some agencies need significant tune-up in that area, and others are doing just fine, in our experience.
Additionally, specific to that issue, it's something we've been in conversations on for at least a year and a half, and there's some challenges that with the actual cost that the BBB charges us, they're looking at significant changes. In addition to that, with the budget, this recent budget hit that was kind of unforeseen, we haven't really been able to sort out the details. But clearly, ensuring that we have enough mechanics and trying to get the mechanics in our house is something that's been a goal of ours. It's something we've been working with Big Blue Bus on.
Looks like we have. Go ahead, Maria.
Yeah. Let's see. How have other departments improved using AVL and interactive mapping with live traffic data?
Anything you can do if you have a pervasive traffic problem is going to help. Some CAD vendors until recently have been very slow. While they did AVL-based dispatching, it was static. It didn't take into account current traffic conditions. We were one of the first, if not the first company to talk to two major CAD vendors. When we figured out how to do traffic congestion analytics, we said this is something that our clients were screaming for. Why should a fire captain be sitting in the front seat with an iPhone trying to navigate an alternative route? Dispatch and AVL should be giving you the route. That generation of CAD software, even if they tried to do it, was frequently sluggish because of the radio modem delay to get the turn-by-turn instructions to the screen, that the engine was already at the intersection or through the intersection before the MDT said turn right. So there's just a lot of technology there, and I don't know what the specs are in your new CAD system. Hopefully that was one of the issues. And even if you try to purchase it, you need to ensure that it's real time, quick enough to the mobile data terminal in the cab for the captain and engineer to actually use it for live routing. That's a good piece of technical complexity, but it certainly should be the goal. And it's also going to improve firefighter and civilian traffic safety. You really need that help to know, hey, my regular response route is a sea of metal right now. I've got to pick a parallel or alternative path.
Let's see, we got another one. Do building occupancy types have an impact in the statistics in regards to travel time in the current report?
Yes, indirectly. So where you've got high density humans per block per square mile, and EMS is 2/3 plus of your workload. If you have healthcare homes, rest homes, skilled nursing facilities, or medical facilities clustered in an area, you certainly have many more calls for service to those addresses. And if they're on a congested boulevard, then you're going to see erosion in response times because you're always going to the same location through the same congestion. So indirectly, I can't say that a 4-story apartment building is going to hamper travel time worse than another building.
Okay, I'm getting some text messages on the side. Let's see here. I guess
the next question is for the chiefs.
Relating to traffic, the city continues to create traffic calming measures with fire department input. How are we going to address this? I guess in related to bike lanes, turnabouts, speed bumps, etc.
So we've dealt with this from kind of day one, but not very successfully. We provide our input, and then mobility and the council provides direction to go ahead with all the bike lanes and the narrowing and such. We're certainly on record with it. I think one advantage now is mobility has been moved and is under the Big Blue Bus. So I've had some discussions with Ed King very specifically to the challenges that this kind of unchecked, really aggressive mobility plan has on our ability to get around town. And I think Eric Binder's done a nice job of trying to state the case multiple times in the more detailed meetings. And so maybe with Ed on our side a little bit, because he's got to get those big buses down those same areas, maybe we can get a little bit more progress. But at this point, just from a political standpoint, mobility's been able to get pushed through whatever they wanted to get pushed through. They did at one time have me sit in on a presentation on little tiny fire engines, and I told them we're not getting tiny fire engines. So there's been all kinds of things about it, but I would just say in Santa Monica, for the foreseeable future, mobility is going to continue to be a challenge on how they restrict our movements to the streets. We talked to them about speed bumps, we talked about lane narrowing, protected bike lanes, everything, and it's just been a challenge. So I don't see a big change coming our way because the current approved bike lanes are still being put in, and I don't think they're going to stop that. So we're going to see an increased narrowing of a bunch of our streets. That's all I have.
Let's see. What are the next steps? Is this information going to be presented to council and city manager? And how are we going to use this data over the next few years to show the need for additional resources?
This has already been presented to the city manager and some key and the finance director and some key players. With the election, just going, we did not send it to council. Although the city manager has an executive report that we'd say, if you want to share it with council, that's fine. I think she really wasn't interested in becoming some political football. The goal is to improve our performance. And where that means we need additional resources, then that's what we'll do. And where it is maybe moving resources or looking into partnerships or different types of vehicles. I think that's one of the things we're looking at with sevens. One of the ideas with sevens was let's be flexible. Let's utilize the right type of vehicles on the beach. What's the right vehicle coming out of there, and address these issues. I think that Citygate did a really nice job of pinpointing and putting some data behind things that most of us already knew, specific to where in the city we struggle to get to, the impact of these homeless-related calls out in the street, and then there's plenty of things to work on. But the goal from this was to get through a strategic plan, which would give us more concrete guidance moving forward, to try and look at the long-range plan. And really, the whole point of this is for us to have information so we can go and have support when we make decisions on how to move forward with the city, and trying to get the city to plan more effectively to ensure that we can keep doing our job at a high level. So we're going to use this in the short term. With this pandemic and the budget, I mean, everything is kind of thrown to the side a little bit, and it's really hard to say how quickly we're going to see significant movement. We're still working on funding, Station 7. So I'd be cautious to think that this is going to, green light us for a whole lot of movement, although it should secure us an effective plan moving forward that the city, if they ask questions, we have answers. And so from that standpoint, we're looking pretty good. But that planning process, that, hey, here's where we need to be, here's an option for adding a station up on Montana or something. We haven't had those discussions yet. And obviously, with a new city manager coming in the next few months, along with this, multiple new council members, we'll see where it all goes. That's kind of a little bit unknown right now.
Chief, if it helps to add to that, I'm shocked is the wrong word, disappointed to see for the second time in my consulting career a wave of requests for proposals for studies for forest reductions. And Sam and I did studies and managed through brownouts and closures during the 08 to 11 or 12 recession, depending on economically where you were. And we're seeing it both in law enforcement, lesser extent EMS and fire, smaller cities than Santa Monica and some counties are fiscally gasping for fiscal air. And their only short-term choice, they believe, is a dramatic reduction in the cost of services. And the fastest way to get that is through deployment reductions, not contract concessions. So I'm not saying it's right or wrong. I'm not saying it's the only way to handle economic challenges. I'm just telling you, as a consultant, we can kind of take the temperature of local government by what we see in RFPs. And I'm not seeing any growth expansion of service RFPs since the start of C19. Master plans, performance audits, how to stretch the rubber band, we did see all last year or since C19. And now we're seeing brownout service reductions, alternative service delivery strategies, anything but adding engines and ladder trucks.
It looks like there's a question about building occupancy types.
We went through that one already, I think. Yeah.
Okay.
Mm-hmm.
Any other questions from the group? Okay, there's nothing else in the chat. Chief, you want to go ahead and close us out? Actually, before we do that, Stu, any other final comments before we go to the fire chief, and then we'll close it out?
No, just thank you to everybody in Santa Monica Fire that worked with us, touched us in IT. It was a frustrating project at the beginning due to the database issues. But everybody, we kept our cool and just stayed the course and dug the information out. And we were thrilled to have been of service and really enjoyed the experience helping Santa Monica. So thank you very much.
Chief Walker, you have the floor, and we'll close the meeting.
Hey, well, first of all, yeah, thanks to the Citygate team for really doing an outstanding job and asking a lot of questions and fighting through a pretty tough start, and then navigating the changes along the way, which we had to change part of what our plan was. We were supposed to be moving on to the strategic plan and accreditation and everything else, and it was just a heck of a crazy year. I just reiterate that this is a tool for us. We have more information. We got a couple things, no doubt, that we can take action on, and I'm happy to say that dispatch has already made some great progress in reducing their call processing time, and that's awesome. I think there's plenty of information out here that's gonna be helpful to us, and the big thing is we need to use the information we have, continue to look for more information, so when we make the planning decisions in the future, we make good decisions. And it's that simple. We want to make good decisions, and this is going to help us do that. So I appreciate everybody taking the time to be on the call. We'll get the document in your hands, and we're always open for follow-up questions, thoughts, and ideas. The folks that are out in the street running the calls have as good or better sense than anybody else of what might work and what might be more effective. And our goal is pretty simple: is provide the best service we can with the resources the city gives us. And so we're going to keep doing that. And I think this document helps us along that path, and certainly along the planning path for the future. So thanks to everybody. Thanks to Chief Clemmo and his leadership on this project, and everybody that helped out along the way. I know a lot of people got tapped for a lot of information, and I appreciate everybody that assisted in it. So that's all I've got, but thanks everyone. I appreciate it.
All right. Okay, well, that'll wrap it up. Thanks, Stu, Sam, Maria, thanks for putting the whole thing together, and Corey, and we'll stop recording. I'll get the link out for everybody, as well as the report. Have a safe shift and stay healthy.